All right, good morning, everyone, and thank you for joining us today. I'm Lisa Berry, and I lead partnerships here at Innovaccer. Today, we're here to talk about a strategic partnership between Innovaccer and Mastech, which leverages our Gravity platform for healthcare and Mastech's rich history leading digital data and AI transformation. With me are the people who made this real: Umang Nahata, Group CEO of Mastech, and Sandy Gupta, co-founder and president of Innovaccer. Umang and Sandy, welcome.
Hey,
Thanks,
Lisa.
Lisa.
Thank you.
Great to be here.
Great to be here.
Absolutely. So nice to see you all and for this to be out in the open for the first time.
Yes.
Absolutely.
So,
Couldn't wait for to talk more about it. It's been brewing for quite some time, so glad it's
yes,
finally now in the open.
yes, exactly. So, Sandy, let's start with you. How will our healthcare industry that we work in here in the US and across the world benefit from this partnership? And why now? Why are we doing this now?
Yeah. So, Lisa, before we talk about that, why we're doing this partnership now, it's important to understand that what kind of challenges the healthcare industry in generally is plagued with over the last couple of decades or so, right? So, healthcare and whomsoever you talk to will always, like every stakeholder, will always talk about that healthcare is plagued with the problem of multiple data silos. The reason why those multiple data silos exist is that healthcare, by the very definition, consists of discrete unique workflows that existed. To solve for those workflows, when we brought in automation and software, let's say a couple of decades back through EHRs and everything else, each of those workflows got a different software at a very high level or some kind of a module in a software which is different. And they ended up creating that different workflow, customizations, and accordingly a different data silo. So healthcare got plagued with multiple data silos. And if you look at now what artificial intelligence has done over the last 3 years or 4 years, it has further plagued this problem. And the reason why I use the word plagued the problem, because with advent of AI, now you can create an application almost overnight. Now, you first, let's say, had multiple data silos that are not talking to each other. In today's data and age, like over the last 3 years, now you have a tsunami of all these AI agents that have just been created that further, I would say, exacerbate this problem with these agents not talking to each other. So, from an innovator point of view, the problem that we have been trying to solve over the last decade is that how do you create a unified context layer? And this unified context layer can sit on top of all these data silos so that you create a unified patient record, a unified data model. And then on top of this unified record or unified context, you can then deliver the right experience both for the caregiver as well as the patient. So that's the journey that we have been on. And what we have also realized, though, in our experience is that a platform is not sufficient for delivering this entire end-to-end kind of a journey. There's an old saying which goes like, you can take a horse to water, but you can't make it drink. But that is like even so true in the healthcare ecosystem. You can deliver the best of the platform, but if it is not delivering the ROI, then what's the point? And that's where something like a partnership between Innovaccer and Mastech comes in so important. And I'm glad that we are talking about it today and like again exposing the world to it.
Yeah, absolutely. Right. I mean, we have a very advanced health AI platform sitting on top of healthcare, providing that healthcare context, but getting there, it's not a 0 to 1 immediately. There's a huge amount of work that has to happen for many different organizations and industries in different areas. And so I think we can just say that the platform by itself was never going to be enough.
Oh, absolutely. Like, and we have said this in so many kind of instances, and that's what the customers have also given us as a feedback. We have to, as an industry of solution providers, meet where the customer is. Now, meet where the customer is like 5 words, but it has got such a deep context to it because every customer is a different level of maturity and maturity from their tech stack perspective, as well as from their operational rhythm perspective. So even before you think about this entire tech transformation kind of an exercise, you have to take certain meaningful steps, which start from planning the right way, enabling that what kind of outcomes do you want to like deliver because of it, then enabling the entire change management aspect of it. So there are multiple aspects where it takes two to tango, and you need a platform along with a very strong delivery organization to make the outcome real for the customer.
Yeah, that's right. So, Sandy, really quickly before, if anyone's just learning about Innovaccer, can you give us the 1 minute version before we start talking about more about our partnership with Mastech?
Absolutely. So Innovaccer is a digital health company We are working with 125 plus provider, payer, and government customers as of now, and we are helping them deliver on autonomous healthcare operations. We do this through a proprietary platform that we have talked about, Gravity, which is pretty much a unified context layer that sits on top of multiple kind of data silos, creates that unified patient record. And once that is done, then we have these predefined agentic families on top of us, which gives rapid ROI to our customers. Now, these agentic families are in the area of, call it, value-based care. They could be in the area of patient access. They could be in the area of referral management, 340B. The list keeps going on. And these are pretty much all the kind of agentic families that our customers have developed or we have developed as first party on top of us. What we are hoping to achieve with this partnership is that Mastic and team ends up creating a lot more agentic families through which we can deliver faster ROI to our customers.
Great. Okay, Umang, over to you. Also, tell us who Mastic is for people who are just hearing the name.
Yeah, hi Lisa. Sure, let me do that. So Mastic is actually one of the oldest IT services companies in India. We've been in business for more than 44 years. The first few decades of that business was primarily around building products and platforms. In fact, one of the most popular insurance platform globally today was built by Mastic. Uh, Over the last 8 to 10 years, we moved out of that product business and focused only on services. And that's where we built a really modern data digital services business that is now focusing towards AI services. Mastech currently operates out of 40 countries and in 5 core industries. Healthcare and public sector are amongst our top industries that we serve. If you go one step below in this, we currently are covering the entire stack of a customer's lifecycle or journey. So from the front office, which is on the customer experience, to e-commerce and patient access in case of healthcare kind of ecosystems. The middle tier, where you will have the core applications, where we could do digital transformations or data transformations or integrations kind of areas. So modernization kind of work there. And then the back office, which is where the enterprise applications or ERP, etc., sits, where we have a very strong partnership with Oracle and the likes in terms of partners there. So the entire ecosystem from data to digital to front office and back office is the service offerings that we really look at. What really makes Mastech unique, especially, is very complementary to what Sandy was saying earlier. Is our mission is not just to deliver technology solutions. We have been delivering some of the most complex and really definitive transformation programs. But what we really take pride on is not delivering those technology programs. It's the business outcome that they delivered in those technology programs, which is really touching the life of patients, touching the life of citizens across nations. And that's what really makes us special. So focus on business outcomes in terms of our delivery, and our whole methodology around making sure that we deliver outcomes is what makes Mastech special. So that's Mastech in a short for you.
That's great. So let's connect the dots now for everyone who's watching. Why this partnership between Innovaccer and Mastek specifically? Sandy?
Yeah. So two reasons really that why this partnership and why Mastek specifically, right? The number one reason is, and I'm not saying this just because Umang is there on the call with me, but the hands-on leadership that Mastek has, I think it just brings a whip of like fresh air. For a lot of other kind of GSIs that we have been talking to or like figuring out to work with, the fact that you get truncated to 3 layers or 4 layers down in the organization like goes on to showcase that the organization is no longer hands-on. And especially when you are trying to deliver these outcomes that Umang talked about to the customers, it needs a direction right from top down. I think in the case of Mastek, we could see that passion, we could see that interest coming in from the leadership, and that got us very motivated. So that's factor number one, that there's a great alignment between the vision of the organizations and like what we are trying to deliver. And that's a great standing point. The second thing is that Mastic also has an amazing global presence. And as Innovaccer, we have been concentrated a lot in the US and the Middle East, and we have been trying to expand. from a geography standpoint. The fact that Mastech is, like, and Umang talked about the 40 plus different countries, but specifically in Europe, the presence as well as the Middle East, that gives us a lot of muscle to now flex and deliver those outcomes that the customers are asking for. So those were the two primary reasons why Mastech specifically and why it got very real for us.
Yeah, Umang?
Yeah, for us, I think the first point is very similar to what Sandy said. We've been working with various global hyperscalers and some of the large partnership companies all across the many years that Mastech has been in business. But as we move forward, we believe it's a wave that is transforming business, and the next generation of players, which is much more specific, much more domain oriented, much more solution oriented, is where the ultimate unlocking of value for the customer is going to lie. Connecting the dots back to our vision of delivering AI transformation for healthcare and life sciences as a core vision statement needed somebody who has a platform and solution that really aligns well there. So while there is strong cultural alignment, like Sandy pointed out, very hands-on in terms of both the teams, but also if you look at the platform and the services business that we have today, also in terms of philosophy, also really align very well. Our view is the platform is really going to be important. There's a lot of fragmented data. There's a lot of disoriented legacy systems, tons of applications that people are looking at. The Gravity platform really allows to bring them together on a single layer. And for AI to really work, it clearly needs contextual data. And creating that contextual data layer is what Gravity really does. So from a Mastech standpoint, if our vision is to deliver transformation, you first need a platform that can deliver contextual data, and that's what Gravity really does. And that's really important. The second part of building a transformation is looking at systems from the process inside out. You just cannot be, without looking at processes, just trying to adopt technology is not enough. So understanding the process and also understanding the organization's culture and how they adopt to a technology is important. So building transformation is not just about technology. It's about adopting the technology so that you get the outcome. Gravity and Innovaccer really bring the technology part in terms of the data contextuality, the process, and then the, of course, agentic layer on top. The Mastech team is really where we look at business as transformation. So using that contextual data with a strong AI model on top of it, and using it to connect the dots in terms of process, change management, transformation, legacy modernization if required, reorganizing their data if required, etc., creates a complete package where we could go out and offer outcome-based solutions to our clients. And that's what we really want to go out and do. We want to deliver business outcomes and not just a platform or a technology. And that's where I think the partnership is really very strong, very complementary. Like I said, from culture to people to the business outcome that we want to deliver to our vision statements, I think we align really well.
Yeah, I think it really extends what we've been doing already. Innovaccer, I would say, does delivery for our customers and our partners across the US and across the world. But we're talking about much larger, much
Yep.
more transformational change across different types of organizations in the healthcare industry. And the kind of experience that you mentioned, Umang, for so many years with Mastech is really critical to doing that. So let's what does this really unlock then for end customers and partners across the world? Where do we think that customers will feel the impact of this partnership the first? And I would say, what are you seeing already in the market? What signals are you seeing where folks are saying, we need this?
So I think there are many important areas. I mean, there are several use cases that I can think of. But I'll start by first and foremost saying this allows us to take the solution, which is already maturing in the North America market, like you said, to some of our global customers back in UK, specifically Europe, Middle East, and maybe in some parts of even Asia. So first and foremost is the reach that it allows us to just unlock the same case studies around revenue cycle, around patient access, around quality of care, etc., etc. So that's definitely one, is just the global access to the customers. It immediately unlocks that, and we are already talking to quite a few of our global customers, and they're very excited about the ability to take the solution to them. The second part, like I said, there are very important use cases, and I'll give an example. From a healthcare CFO standpoint, the rising costs of healthcare and the denial rates not going down or the quality of care, and is just a big huge chaos. And on top of that, it is leading to a lot of administrative time being spent on back office areas rather than working on patient care. Now, if you try to connect the dots, for the CFOs to really make good financial cost or like an activity based costing, they would lead the clinical data, the financial data, and like the HR or skills data combined together in one layer. While Innovaccer does that understanding of that data together, Mastech's experience in terms of understanding back office or, like I said, the middle office and front office allows us to process or look at the underlying systems and processes together. And also the domain expertise that we bring in to really look at how do we unlock that data with AI to create, sharper solutions that will allow tangible reduction in cost of care and therefore move back time to patient care rather than spending on administrative activities. I think just that simple goal of taking away time from back office administration to much more on patient care itself is a phenomenal goal. I mean, on top of it, if you can do it securely on with all the privacy needs that healthcare has, I think that's going to be a phenomenal outcome for our customers.
That's a great example. Sandy, how about you?
Yeah, no, I'll just extend what Umang you were talking about, right? So in the beginning, when I was introducing Innovaccer, I talked about that for us, how driving autonomous healthcare operations is the key outcome that we are driving for our customers, right? Now, Umang talked about a use case. Let me talk from a numbers perspective. If you think about, let's say, United States, we spend like what, give or take $5.5 trillion in our healthcare GDP. If you add, let's say, Europe and then you add Middle East and then some parts of Asia, you're talking about a 7 trillion. So, but like take $5.5 trillion as a baseline, right? Now, the administrative loss ratio. There is a medical loss ratio, which is the actual caregiving that you have to do, and then the administrative loss ratio, which takes care of all these other administrative works, which is around calling your billing, your RCM systems, your all the administrative layers that are there, and all those kind of things, right? They are 15% of healthcare. So 15% of $5.5 trillion, you're talking about $800 billion on administrative functions that is spent. $800 billion that could go in patient care. Now, let's say if you are able to drive some of these autonomous healthcare operations, you will not be able to take away the entirety of it, but maybe you can help cut down 15% to 10%. So you can have a 5% saving. Because let's say even in a simple case, you are working both with a provider and a payer in an ecosystem. The provider is lobbing a bill from side A to side B, and the side B is then reviewing it. You call it prior authorization on one side, you call it utilization management on the other side, right? There's two sides of the same coin at the end of the day. So my point being, cutting down 5% cost is not that big a thing. So 5% of $5.5 trillion, you're talking about roughly give or take $275 billion, rounded off $300 billion of saving. Now, that's a huge saving from a number perspective that you're talking about that our customers can drive. Now, to help them drive and deliver on this outcome, that how do you really go about the journey of autonomous healthcare operations? You really need to understand where they are today. So you have to meet where they are. As we said earlier, you need to understand their tech stack. You need to understand their entire kind of their workflows. And then you need to understand that how will you drive this autonomous operations. And to do that, you have to sit down with them. You have to like do that entire process what Umang was talking about. So those are the meaningful outcomes that our customer should be like expecting from us. I think whenever we are sitting down with the CFO, the ask should be that, okay, what is the outcome that you will drive and make it real in terms of the dollar term right now? And can you even take risk on it? Because we do not want to do call it a tech transformation for the sake of it because it's the right like because everyone is doing it. That's not why you should do it. You should do it because you can expect meaningful dollar outcomes and obviously better patient care, because all those dollars saved, you will reposition them into better patient care. You can hire more doctors, you can ensure the patient gets more face time, all those kind of good things as to why the doctors came into this industry in the first place. So yeah.
Yeah, wonderful. So, big picture, what does success look like a year from now? We're announcing this in August 2026. What are we looking at a year from now with this partnership? Sandy, what does this look like for you in about a year?
Yeah. So for me, I think the a great thing to expect from this partnership, call it 1 year or 2 years from now, would be that we should be able to call upon a health system, be that in Europe, call it in UK is Europe, so let's say Middle East, and then one in the United States. So three health systems, and when we ask them that, okay, what has this partnership done for you? I think they can talk about the meaningful outcomes we have delivered, number one, and they can talk about a singular platform and a singular team delivering it, rather than it being that, oh, you know what, there are multiple stakeholders, we don't know what the heck is going around. That would be a detrimental part. But if they can come out of it and say that, you know what, we really love the work that Mastech and Innovacer has jointly done for us, that is what we want to hear.
Yeah. Umang, how about you?
Yeah, I think the way I will look at success is we are in this era where AI is really taking over the world, right? From everything that we do, every topic that you talk about, it's all about AI. But whether AI is delivering the outcome that we want, whether all the hundreds of billions of dollars that is going in, is it delivering the tangible outcome that would really benefit the world, is not visible yet, not substantially yet. What I would look at is if we are able to use the data and the technology platform that we have, along with the adoption layer, where we're really able to, make sure that our customers are able to adopt the technology to deliver their business outcomes, and therefore create a future where we can, bring out stories of using the technology that we are advancing so fast with to, meaningfully deliver business outcomes to our customers. And like Sandy said, maybe 3 or 5 or 10 customers from across the globe, where they can represent and they can share their stories back of how they use their data and AI to drive meaningful outcomes in their businesses. I think that would be a phenomenal success to have in terms of really making an impact to the world.
That's great. Okay, well, I mean, this is the whole point of this, right? We're trying to do these AI transformations to make it so that people can deliver care better, that we can focus more on actually delivering care, that we can cut out some of that administrative cost that is unnecessary, that we can maybe potentially bring down the temperature in the fight between payers and providers and actually focus on data and outcomes. So really excited to work with both of you on this. This is a partnership we've been working towards for quite some time, as we mentioned. So it's great for this to be out in the open. And I think that's it for right now. We might be able to take some questions, and we're ready to get to work. Thank you both.
No,
Thank you,
thanks,
Lisa.
Lisa. This is
Let's get
great. We
rolling.
look forward to the next things.
Thanks, everyone.
Thanks. Bye-bye.